All of the practice guidelines for the treatment of lower back pain recommend education as a primary treatment approach. But can someone actually really talk you out of low back pain? In this episode, we'll discuss education and low back pain. A study just published in the Journal of the American Medical Association looked at the effects of patient education compared to a placebo education group for the treatment of lower back pain. The patient education group was educated by Professor Lorimer Moseley, who is one of the leading researchers on pain science, and they wrote the book Explain Pain. And so what that approach basically entails is that it looks at the biopsychosocial model of pain. So essentially saying that there's biological factors, psychological factors, and also social factors that can all contribute to pain. The placebo group in this study consisted of advice to remain active and to avoid bed rest, but it didn't include any of the education components about the nature of pain. And what the study found was that the patient education group was not more effective than the placebo education group at reducing pain intensity or disability in the short or long term. The patient education group was statistically better at reducing the disability at 1 week and 3 month marks. However, it wasn't deemed clinically significant. Although all the clinical practice guidelines recommend education as a primary treatment option, this study challenges the value of that recommendation. While it is important that we communicate why someone has lower back pain and also effective treatment options for lower back pain, the education component alone doesn't seem to actually help reduce the pain intensity or the disability. And this even includes reducing the risk of developing chronic low back pain. This study highlights that just because something makes sense doesn't actually make it true. Some therapies are frequently criticized, so if we're looking at manual therapy and spinal manipulation, they're frequently criticized because they're not better than placebo in some studies, whereas patient education typically gets a free pass where it's not held to those same standards. But this study that was just published in JAMA shows that the education component wasn't actually better than a placebo education group. So it's just important that we hold all therapies to the same standard. There shouldn't be a pain science tribe that just strictly advocates for a hands-off approach in the treatment of pain, and then a manual therapy tribe that strictly advocates for soft tissue work and spinal manipulation. Regardless of which tribe you might have an affinity for, anyone who's treating people with low back pain should take a look at all of the evidence equally and create an effective evidence-based treatment plan that's going to have the quickest recovery for the patient. Thank you for watching this episode on education and low back pain. I hope that you found this information useful. If you did, go ahead and give this video a big thumbs up. If you want to see more of my content, go ahead and hit that subscribe button, which I think is over here, but you know what? I never know, so it might be over here, wherever that red button is. Go ahead and hit that subscribe button, and I'll see you guys in the next episode.